I've always said we don't do no. What we do is varying degrees of yes. Yeah, there are some things that we can't do, but you know, you've got to work with people so that they can do something for themselves.
They were thinking about giving up smoking. They hadn't decided on a date, they hadn't gone to the GP, they hadn't purchased any products. We knock on the door and they only have to walk around the corner to one of the clinics and they get all that support.
Oh, it's really nice, the fact that people are coming in and they're getting the carbon monoxide levels of a no smoker and they can't believe it.
Makes me feel more confident to stop and say I stopped it. And my kids, if it's in me, it's in them, isn't it? So I feel really good, really, really good.
Around 9,000 people live in South Workington, and on estates like this one, Frostham's, 40% of the population are smokers. That's just about twice the national average. It's one of the reasons why the health prospects of people living here are amongst the worst in Cumbria. Not only that, many people here simply don't access local health services. That's why, when it came to trying to help people stop smoking, South Workington's neighbourhood management team came up with a new plan. Working with a range of partners, including NHS Cumbria, they took to the streets, knocking on people's doors to offer help and support to quit.
The current system, you know, it relies on people to access it, and what we wanted to do was to go out and let people access it on the doorstep. So we came out, we got 20 volunteers from the different agencies. We put them through, we work with, obviously, with the NHS Cumbria and the PCT, and we got 20 volunteers. They then undertook brief intervention training, level 1. That gave them the confidence to go onto the step, because it is difficult, there's no doubt about that. You go and knock on the step and you're asking people and you're talking to people about stopping smoking. And we went and done a week of action.
So you've got the patches?
Yeah. And
I've got them. The lozenges?
Lozenges.
How are you finding them?
Horrible.
35-year-old Stuart is one of about 130 people who responded to the campaign. As a result, he was fast-tracked through the system, getting a phone call within hours and an appointment with an advisor, almost on his doorstep soon afterwards. He's not had a cigarette for 5 days, and today he's finding out if that's made a difference to the levels of carbon monoxide poisoning in his blood.
That's improved. I couldn't do that. That's improved. I couldn't do that last time.
No, you couldn't breathe like that. That's excellent. So you would appear...
I'm down to believe it.
You're a non-smoker because you haven't had a cigarette, and that shows that you haven't had a cigarette. How do you feel about that?
Yeah, it feels good. I feel a lot better. That's unbelievable the way breath just went on. I couldn't do that last week.
No, you couldn't.
I felt absolutely great. It's unbelievable how much was in and then disappeared. And makes me feel a lot better. Makes me feel more confident to stop and say I stopped it. And my kids, if it's in me, it's in them, isn't it? So I feel really good, really, really good. Happy about it.
Trained community advisor Patsy Macmillan is herself an ex-smoker who lives on the nearby Salterbeck estate. As part of this project, she's now holding weekly clinics in 4 separate centres in neighbourhoods in South Workington. The post is funded by NHS Cumbria.
Well, it's all new to me because I just started my job 2 days prior to getting all the clinics sorted, and to go through 130 referrals was a job. Some of it's been very rewarding because a lot of people who wouldn't have self-referred have had the chance to get appointments pretty quick. And other people do want to stop, but they don't want to stop now, and I've got follow-up appointments for them. So yeah, I think it's been... Some people don't want to stop. They did say they wanted to stop, but when they got the option of an appointment, they haven't wanted to stop. So, but it's been good.
Another of the people determined to give up is herself a community involvement worker. She's in no doubt about the benefits of Patsy's advice and support.
She helps you decide which would be the best, is most suitable for you, the products that's available to help you give up smoking, and then also that bit of a check-up really to see how you're doing, and things like that. It does put a little bit of pressure there to stick to it as well. No, I think it's really important.
0.
All right.
That's brilliant, absolutely brilliant. Did you think that would be 0 today?
No, because I thought, well, just with the normal fumes in the air.
No, you're not even on the scale now. No. So you were way up here, you were off the scale, so now your blood is pumping oxygen around your body to your brain, your heart and everything. It's now doing its job as it should be. Okay. That's a good incentive, isn't it, really, when you can say that to what it was 22. So although you're getting the nicotine from the patches, you're not getting all the poison and stuff that that comes with it. Oh, that's absolutely brilliant, Heather.
But I won't be going back on them.
You're determined, I can tell. Oh, it's really nice, the fact that people are coming in and they're getting the carbon monoxide levels of a no-smoker and they can't believe it. And you tell them that will happen. And then when they come in and they said it's been difficult for them and they're getting the low readings, they can't believe it. It's really encouraging and I'm really pleased for them.
What's happening here is a great example of how things can improve when local agencies are able to take action themselves. This project has brought frontline help to where it's really needed.
What we have done was we've moved probably 130 people on to the contemplation stage, so they've clearly thought about stopping smoking. Out of that, we've got, I think it's round about the 50 mark of people who have started to access the clinics. That's 50 people from our estates who I don't think would have accessed the system as it currently works because we went out and knocked on doors.
The number of people that, they were thinking about giving up smoking, they hadn't decided on a date, they hadn't gone to the GP, they hadn't purchased any products. We knock on the door and they only have to walk around the corner to one of the clinics and they get all that support. And the benefit of that to them, financially, health-wise, and to the PCT in the long term, it's fantastic, and it's just knocking on the door and those people saying, yes, I do want to stop, but I hadn't actually gone and accessed any of those services.
And it's about attitude, really, and that it's about, if you've got people, like-minded people, I mean, I've always said, we don't do no. What we do is varying degrees of yes. Yeah, there are some things that we can't do, but, you've got to work with people so that they can do something for themselves. Look, these people, some of them clearly were thinking about accessing the service, and they haven't done that. And we've went out and knocked on doors with all the other agencies, and we've got 50 people to stop. So there's an example of, changing from the norm and doing something slightly different. And I think we would be had a success.
It's improved.